हेलो फ्रेंड्स। आज हम बात करेंगे रोल ऑफ न्यूट्रिशन फॉर द बोन एंड जॉइंट्स हेल्थ। Health and strength of the bone and joints rely on a balanced diet and a steady stream of nutrients, most importantly calcium and vitamin D. Calcium is required for building and maintaining strong bones, for muscle control and blood circulation. It is not readily available in the body. It has to be absorbed from the intestine from the food we eat. And for absorption of the calcium in the intestine, vitamin D is required. So if we have low calcium levels in our food which we eat or which we consume, then the stores are depleted from the bones. So calcium is removed from the bones, which leads to osteoporosis, which is called as fragile bones. Most commonly in postmenopausal women, osteoporosis is very common because of the loss of the bone stores. Men are also affected with osteoporosis, though in the later part of their life. So calcium requirements on a daily basis is approximately around 1 gram. Adolescent age needs a little more, and similarly in the elderly age, the requirement is more because the bones are getting depleted. So for making a new bone formation, calcium is required. The dietary sources for calcium are mostly the milk products, yogurt, cheese, dairy products, and green leafy vegetables, cabbage, tofu, cereals, breads, and other fortified foods. So vitamin D is a very important mineral which is required for the absorption of the calcium from the intestine. If we are deficient of vitamin D, then in children we can suffer from rickets, which can lead to deformities of bone and fragile bones, while in elderly patients, it can lead to osteomalacia, which can lead to bone pain, fragile bones, and more predisposition to fractures. So daily requirement of vitamin D is around 400 international units. In the infant age, it's around 600 international unit from the age of 1 to 5. And in further other ages, it is the requirement increases to about 1000 international unit per day. If we are found that the vitamin D is deficient, then we can consume through supplements, and we have to be very careful that these supplements should not be too much, which might cause some other problems. So on a daily basis, one can consume around 2000 unit to 4000 unit per day, or maybe 60,000 units per week if they are found to be deficient in blood reports. So the other nutrients which are important for the bone and joint health are uh, cartilage formation. Cartilage is formed with chondroitin and glucosamine, and around 70% of the cartilage is around water. So hydration is very important for maintenance of joint cartilage. One should always take around 6 to 8 glasses of water per day. Nutrients which are required for bone health are phosphorus. It's one of the major nutrients in the body's bone crystal. And how we can get phosphorus is dairy products, meat, beans, and lentils. Then magnesium, it provides strength to the bone. It can be provided with spinach, banana, nuts, and chickpeas. These are good sources of magnesium. Vitamin K, there are certain other vitamins which plays important role in the bone health. Vitamin K is required for bone formation and mineralization, and also for cartilage formation. And it can be provided with leafy vegetables, pumpkin, kiwi, avocado. Vitamin C is required for the collagen form synthesis. Collagen is the main content of the cartilage around the joint, and if we are deficient of the cartilage, then we are bound to have joint pain, and the strength of the joints will not be adequate. So vitamin D also plays a very important role. And how we can get vitamin C is from citrus fruits, tomatoes, and vegetables. Then other vitamin which is important is vitamin A for skeletal growth. it can be provided with the liver, egg, butter, vegetables. One should always be careful that you should not be taking an enormous amount of vitamin A because it can lead to further complications. So it should be balanced diet. Now, apart from nutrition, two important parts are there, that exercises on a regular basis and adequate hydration, which is important for the maintenance of bone and joints. So regular exercise is important. So in short, we would say that for healthy bone and joints, a balanced diet is a must. We should do adequate hydration. We should be following a regular exercise pattern. And if we should be regularly screening, uh, means that we should get a regular test done for vitamin D and calcium and other nutrients. And if they are found to be deficient, we should take oral supplements. Thank you.